The essence of spirituality in the hospital setting is accompanying patients wherever they are. So if a patient is feels that they're in the valley of the shadow of death, we sit in the valley with them. If the patient is feeling that they are trudging along the mountainside toward healing, well, we're trudging with them. So we're with them in every mood, and we really try to attune ourselves to the mood that they're in. And the reason I'm saying mood is that spiritual concerns and emotional concerns are very much intertwined. So that why me is a spiritual question, it can be a spiritual question, and it's also an emotional question. And when we are specifically called to a patient's room by another staff person, sometimes it is because a patient has expressed what we might consider to be, very much in the spiritual zone, like God must be punishing me. But sometimes we're called to the patient's room because the patient is crying, and they're thinking it might be helpful for the patient to talk to a chaplain. Interpreters are our partners in all of those tasks. And for me, working with the interpreters at Stanford, it's the only healthcare setting I have worked in, I've always been impressed by their warmth, that they are showing up with their full emotional selves. And that is so critically important in this kind of encounter. Because often what we're doing is we're showing up, and what we say in the chaplain biz is we're providing a non-anxious presence. And so since the interpreter is actually the person who is, we're both speaking directly to the patient, but you know what I mean. You are the ones who is speaking to the patient in the language, or the family member in the language that they understand. And so just as chaplains, we use our full bodies as one of the tools of our ministry. It's helpful when the interpreter is congruent as well, and is also providing that non-anxious body language. So what do I do as a chaplain in order to treat the interpreter as I regard the interpreters I work with, which is really my partner in caring for the patient? I really try to check in with the interpreters I work with both before and after the visit. If it's possible, I don't go into the patient's room before the interpreter is there, so that we're not in a situation where I'm already in the room and the interpreter just has to come in and we immediately go into introductions. I try to either be outside the room, or if I am in the room, I try to go outside the room to speak with the interpreter first. And part of this is to say, this is what I think is going to happen. I don't always know, but this is why we've been called, or this is what the patient has requested, or this is the range of things that might happen. But also so that we can look each other in the eye and really ground ourselves before we go into the room together. And then afterward, I know that we're going to talk about this more later, I know that sometimes these interactions are very moving and affecting or upsetting or any number of things for me. And I also know that I don't assume, but that may also have been true for the interpreter. And so I, again, try to have us have at least a couple of moments afterward to check in. Susan now is going to talk about one of the primary tasks that we do as chaplains, and that is to provide different kinds of rituals.
So often, if you've worked with chaplains before, you know that we get called to do emergency baptisms. That's one of the the issues that comes up with families and particularly infants. And so part of what we do is to make this happen in a way that is appropriate for the family. And as Lori said, we try to talk with the interpreter ahead of time so that they know what's going to be happening and they're not surprised, and we work together on that. We also tend to want to be open to sort of a movement of the spirit, or to be flexible in how it happens so that the family can be included. And so sometimes for us it means that we have to find a particular space. We may have to find some particular materials for some ritual that the family has asked for. And we try to make this connection for the family with their with a religious person from their faith. If the chaplain is not of their faith and they really want someone of their own faith, we try to make that happen. We have lists of people who are willing to come in. We make those calls. In some cases, there are Buddhist families who need someone to come and do some chanting when it's near death or at the time of death. And so the interpreter can help us to hear what the family need is, and then we can help make that happen. Other kinds of rituals that we're a part of would include a marriage. There have been several this year at Stanford where one of the partners is very ill, but the couple has been together and they've been planning to get married, and now they want to get married. And so the chaplain will work with them to get the marriage license, and we even had one recently where it took place in the patient's room. Some volunteers donated some money so the bride could have a new dress, and someone else went out and got a cake, and another of our volunteers went out and because of where the patient was, you couldn't have any live flowers, so she went and got some silk flowers and made bouquets for the bride and also a boutonniere for the groom. And so that was a ritual that interpreters could help with to make it happen the way the family wants it to happen. Sometimes on a happy side, there's a family that wants a blessing of a child because they're so grateful that things have gone well. They've been so worried about their child, there's been a surgery or there's been a treatment and things are looking well, and they'll say, we want a blessing. And so we will come and pray with them, and the interpreter will speak the words of the blessing for us. There are also end-of-life blessings. When someone is dying, it is a way for the family to participate and to gather around the bed and to share in the prayers for the one who is dying, and to be there and to say their last words to the one who is dying. And again, the interpreter is really integral to help make that happen for the family's sake and for the one who is dying. Other kinds of rituals include sometimes when there are children involved, children will like to have a handprint of the person who died. So in one instance, it was a man who was in his 30s and he had 3 small children. And so for those small children to grow up with this remembrance of their dad, a very physical thing where they, throughout their life, they can put their hand against his hand and see how their hand is growing. And so the interpreters can help us with explaining what's going to happen, and the nurses will help us by actually sometimes making the handprint. But it's another ritual kind of way that we connect then with the family and help them through this really difficult time.